Doctors of Reddit, do you ever find yourselves googling symptoms, like the rest of us? How accurate are most sites' diagnoses? I've worked in 2 emergency departments and doctors have no shame in googling something they don't know. It really saves them from making an error and allows them to continuously learn different things. In the air you see so many different things and are bound to come across cases so unique that you hardly have any background knowledge. Anything Googled usually comes from a reliable medical journal and docs generally cross-reference to verify information. 4th year med student here. My diploma might as well say the Google School of Medicine when I graduate. We definitely do. We use Google, Wikipedia and lots of free and subscription apps to find what we are looking for. The difference is that we know how to word our search to find what we need and how to filter the crap and pseudoscientific results out. It makes a big difference when you search for, say, allodynia and edema and blanching erythema rather than painful swollen and red, or can interpret articles and studies with a critical eye for their use of statistics, that is, looking for absolute rather than relative risk reduction, power of the study, inclusion/exclusion criteria, number needed to treat, efficacy vs effectiveness, etc. That's all stuff you learn in medical school. Then as you progress through practice you get better at pattern recognition. Medical education is as much about learning how to learn as it is about what you learn in school. TLDR, yes. I think it's important to note that when a doctor Googles your symptoms, they use their education to filter out false positives that a layperson might not, and don't have an agenda. Meaning, they are looking at the results objectively, whereas I might downplay or overemphasize certain symptoms when Googling my own condition, because I have a deeper emotional stake in the outcome. In other words, please don't think that, because medical professionals use the internet to research your conditions, you can justify cutting out them out of the equation. Also, it's lupus. They definitely do, and very often. Usually they know which things are reliable and how to search based on their medical knowledge. If you go to the right sites/journals and you know which symptoms to type in and how to accurately determine if you really have those symptoms, then it can be very accurate. You also have to know how to discard inaccurate results. If it gives you a rare blood disease only found in Africa and you have never left Kentucky, you probably don't have it. Source: wife is a doctor. My doctor once talked me through what she could find about my symptoms on Google. It was a little surreal at first, but she explained how there are reputable medical journals out there, and their search functions are rubbish, and going through each one would take a long time, so they use Google fairly frequently when diagnosing and treating patients. I look things on the internet all the time. I often do it with the patient. The other day I had a patient tell me she was on a birth control pill I had never heard of. I looked it up, and it was a generic for a very common pill I immediately recognized. We then had a very useful discussion regarding side effects and options. The patient appreciated what I did. When I left the room, the resident I was working with commented that he was impressed by the interaction and was surprised how much being honest with the patient about not recognizing the generic helped improve the visit. I also developed my own website, medtwist.com, for patient education. It gives me a place to direct my patients, so I know they have a place with quality information, as least as quality as I may be. Family practice physician here. I tend to run into mostly the same illnesses and complaints day in and day out, but I will Google symptoms if diagnosis has ruled out the most common options. I will say, however, that for most problems that bring people to the doctor, upper respiratory infections, minor injuries, the websites are actually quite accurate. Their drawback is, of course, encouraging the hypochondriacs that they might have a rare, incurable form of cancer, a tropical disease, or super AIDS. I do it all the time. Part of what hasn't been touched on so much is knowing what information is pertinent about the patient's symptoms. Most people who come in with a problem will have a handful of generalized symptoms that don't tell you a whole lot by themselves, but there will often be one particular symptom that is extremely important that helps guide your answer. Knowing what the important thing to zero in on is where the education and experience comes in. medical librarian here. Doctors certainly do use Google and Wikipedia, much to the annoyance of medical librarians like myself. We buy access to quality information, so they can make the best clinical decisions to improve patient care. Many doctors think they are above searching journals and databases once they graduate. The reality is that the best doctors never stop looking stuff up. Better doctors ask medical librarians to do that for them. They are best at treating patients. We are best at searching for top quality medical information, which you won't find on Google or Wikipedia. Ask Gregory House. You might be surprised at what he knows. I'm a doctor and I use Google. Saw a good quote the other day, from doctor to patient. Don't confuse my Google search with your Google search, which I think is very true, which definitely impacts on accuracy. That was the first example I could think of. FYI, for patients I recommend patient.co.uk and nhs.co.uk. Parents are both doctors. That is what they are supposed to do. In the old days before the internet, they either flipped through books to get ideas, or asked other doctors to check the patient in the vain hope that they might have an idea. First year doctor here, completed all of medical school. I do when sometimes I haven't heard of a certain syndrome or condition, or when patients tell me the brand name of a drug which I've never heard of yet, or often what a medical acronym in the notes mean. For the most part, we will use more reputable circumstances like UpToDit to read up about pathophysiology and investigations. I would rather have a doctor Google something they didn't understand, or was not up to date on, than have them stubbornly insist that their information/method, which they didn't update since med school, and has changed since then, is correct. I once had a doctor Google my symptoms right in front of me, while I sat in his office. I imagine new doctors do it all the time, and like with all of us, it comes down to being experienced enough to filter out the wrong answers. Pharmacy student here that runs with a general medicine team. We constantly use a site called UpToDit, which is basically a Wikipedia for medicine, but with better sources. For instance, scientific publications, case reports, therapeutic guidelines. For drugs, my pharmacy team frequently uses Lexicomp and Micromadex. Note that all these websites are subscription programs that would cost thousands of dollars per year, but are supplied for free by my school/institution. Doctors look up stuff all the time, but on reputable, and often paid, databases. In the hospital where I work, we use UpToDit. Well, I'm a doc, MD, pediatrics resident to be specific. I don't use Google very much, because the evidence is pretty poor, and unless you know how to scrutinize it, even when you do, you realize a lot of the info is pretty poor quality. Go-to quick references include things like DiaGnoses, Clinical Key, and UpToDit. We absolutely use those references to double check our differential. I also find plenty of good information online to guide my clinical decision making. AAP is a goldmine for me, especially review articles, and every specialty has its own. We also use guidelines from expert sources. ACR appropriateness criteria for deciding which imaging. If we are uncertain, NHLBI for asthma recommendations, IDSA and Red Book for antimicrobial guidelines, Lexicomp for dosing, etc. There are just amazing resources available to clinicians that I feel like most docs who use Google or Wiki are simply unaware of the better options out there. OMG, they're using Google. WTF. Doctor visits a website maintained by their professional association, for which they pay thousands of dollars in dues each year, goes to archive of actual medical research studies for information compiled by other doctors based on thousands of patient interactions. Average patient can't tell the front page of a research study from a Google search result while peering from across the room. Not a doctor. Other people who are also not doctors need to stop masturbating on this topic, not in general, and let the doctors answer. A difference between a physician Googling medical stuff and a patient doing it is that the physician has training and context to evaluate and interpret what comes back. Some patients on Google are well informed, some dangerously misinformed, some don't know there's a difference. A professor told me in med school that the main aim of med school is to teach the students how to take a proper history, perform a thorough physical examination, know a few of the common ailments, and, most importantly, where/how to look for the answers. Essentially you learn the basics of medicine and pick up the rest following graduation. The first month of residency is quite mind-blowing, but I just found myself going back to the basics as I was taught, and the management algorithms can be referenced somewhere, books, internet, a senior doctor. So give me the bad news document. Well, after googling your symptoms it seems that you have lung cancer, herpes and gonorrhea. I diagnosed myself needing an ulnar nerve transposition via Google. My GP in the local hospital disagreed. I complained and moaned for 2 years in pain. Saw a consultant. Within 30 seconds he felt my elbow and said, "Oh boy, yes, I can feel your nerve slipping around, operation soon." Meh. I got a little bored today and decided to see what would come up if I searched for vertigo and nausea. I kid you not, plague was on the list. Plague. Yes, sometimes these sites get a person to realize they need real medical attention, but more often than not they are getting scared over nothing. That being said, I usually refer to textbooks if I need to reference any symptoms to a case, but I have used Google for a particularly strange case that stumped a lot of us. It didn't really help though. Edit. I don't understand why I'm being downvoted. If you input the correct symptoms, most websites just give a % likelihood that you have each of the possible diseases associated with those symptoms. The problem is not Google's accuracy, it's with human psychology. When you find out that your sore throat is 95% likely to be strep throat or a bad cold, and 5% likely to be cancer, most people, myself included, are inclined to overreact and assume the worst. Not a doctor, but had to take my son to A&E with strange bruising on his legs and pain in his knee. The doctor said the symptoms rang a bell for a condition he'd heard of but rarely seen, and he couldn't think of the name. A quick Google, and he came up with the Henoch-Schönlein purpura. Urine and blood tests confirmed that this was indeed what my son had. I would be interested in understanding why, when I Google my symptoms and take my results to my doctor, she denies my claims and then Googles in front of me on her laptop to the very website I went to.